Hello, welcome to the LA Institute video series. My name is Dr. Ruiz, and on this video we're going to talk about the making of predictable, simple Class 2 and Class 3 direct composites. This is something that you're going to encounter on a daily basis. So the making of predictable and simple Class 2 direct composites is really bread and butter dentistry. We're talking about procedures that we do every single day, multiple times a day. Being efficient, being effective, being successful predictably is so important for the happiness of any general dentist, any restorative dentist. So the objectives of this presentation is to discuss the principles and steps necessary to make simple, make them predictable, those bread and butter procedures, the Class 2s and Class 3s direct composites. And of course that includes also Class 1s because it's part of the whole thing. The steps are simple. I mean, there's a list of things that we need to do predictably, successfully, efficiently, and we're talking about first preparation of the restoration, then matrix, liners, bondings, the filling, the step-by-step filling procedure, morphology, finishing, and then do all of this, timely and profitably. It sounds difficult, but it's really not. I want to just quickly share with you a technique that I find that really saves me a lot of time. And this video is about making things simple and quicker and efficiently. And I tell you something, anesthetic is one of those things. I strongly encourage you to use Septocaine because if you use Septocaine, the anesthetic time goes down dramatically. If I use Septocaine on the maxilla, I can start prepping the Class 2 or Class 3 in 2-3 minutes. If I use Septocaine on the mandible, same thing, because guess what? I don't block. I haven't blocked in over a decade. I use what I call Supra-gingival anesthesia procedure, and the first thing that I do is I will place like a quarter of the carpule of the anesthetic right below the tooth that I'm going to work on, but I'm going to do it on mucosa. I'm going to do it very gently so it doesn't hurt. I'm going to deposit slowly a quarter carpule right below the mucogingival line, and so it doesn't hurt. And then half of the carpule of the remaining anesthetic is going to be deposited in the distal papilla of or not. It doesn't have to be right straight into the papilla, but it would be close to the papilla in the mesial and the distal. And you need to see a little blanching. You don't want to see a lot of blanching because if it blanches too much, then you may have the tissue may get irritated and they might have a little soreness afterwards. But you do need to see a blanch, otherwise you're not sub-periosteally. And this technique works like a charm. I've been using it for over a decade with incredible success. Then after that, certainly the preparation is incredibly important. And when we're doing direct composites, we're not going to do GB Black Class 2 preparations or GB Black Class 3 preparations. I mean, we're talking about adhesive dentistry here, so GB Black is history. The principles of preparation are completely different. There is no specific outline. We don't need the dovetail shape on a preparation. Really, the goal is to be as minimally invasive as possible, so minimum extension is desirable. If you trust in adhesion, and I do, then that means mechanical retention is not necessary. I never put mechanical retention on any of my restoration. I don't remember, in the past many years, I don't remember one restoration falling off. No boxes. Boxes are a remnant of GB Black, and boxes just lead to excessive tooth removal, unnecessary tooth removal. No aggressive gingival clearance. When you do a box and you want to develop that gingival clearance, it tends to force us to drop the box beyond what is desirable. The more you drop the box gingivally, the more you get into the soft tissue, start creating bleeding. And of course, when it comes to adhesive dentistry, bleeding is a terrible thing. Then of course, if we keep dropping the box in order to create clearance, then we start losing the enamel, because the more gingival we go, the less enamel we have. All of those, make, boxes and gingival clearance with, by dropping the box extremely undesirable. Beveling is really not necessary, because although research clearly shows that when you bevel and you have 45-degree enamel, you increase your adhesion, but it's all academic. A few megapascals doesn't make any difference. Clinically, it's not going to do anything. The only thing they do want to do is definitely remove the weak enamel. So do a quick pass with your diamond, so that way you get rid of all the loose enamel rods. And by doing that, you decrease your chances of the white line, and by doing that, you also, have a better seal. But no specific, bevel with certain thickness and certain angle. I mean, that's just unnecessary time that is not going to do much. The preparation of a slot prep is really a very important thing. The proximal box is no longer the typical GB black geometric shape. We're now that we understand that adhesive procedures allow us to preserve enamel, and sometimes we can even preserve enamel without the support of dentin, as long as we have a full thickness. Then the proximal shape of that changes pretty dramatically. The black line that you see there on your screen, that is your external outline for a slot preparation class 2. And as you can see, there's occlusally there's no dovetail. Proximally there's no square geometric preparation. It's a small occlusal axis. We expand internally. As long as we remove the caries, we're happy. So smaller instruments is also desirable. The bigger drills leads to more and more excessive unnecessary removal of tooth. Right there you see me with a 333, which is like a pear-shaped burr, and basically the preparation, as we talked about, is minimally invasive. We are going to use magnification as much as possible, and good illumination. We don't want to forget that the day of the geometric preparation is gone. Sometimes we may benefit by extending internally and leaving the external outline a little bit smaller. That when we do that, that tends to leave a little bit of unsupported enamel on the periphery. But if you look at the picture that is on the right, that's the picture of a class 3 restoration, you will see that the external eye line is considerably smaller than the internal. Internally, especially in that distal area, the enamel removal, the dentin removal is considerably deepened in the external enamel outline. Now, as long as we have a full thickness of enamel, we can preserve that enamel, and the benefit of that is, by doing that, I'm leaving the margin above the gum. Can you see that on the distal portion? That makes my repairing that tooth a lot easier. Now, if I was going to go with the traditional no enamel without dentin support, then my preparation would go considerably below the gum, and then restoring would become considerably more difficult. But again, the rule is we want the full thickness of the enamel, like you see in the middle picture. Although the cusp might be slightly undermined, but the thickness of the enamel is still the full thickness, and the research that you see underneath confirms that when we restore enamel with composite properly bonded, we regain a considerable amount of strength. So preparations the preparation are different, are more conservative, and then the goal is to preserve as much enamel as possible. So you see right there a finished preparation. Sometimes when we finish a preparation, we might end up having a tiny bit of tooth in contact with the adjacent tooth, and a little bit the cable margin might be in contact with the adjacent tooth, and quite honestly, that is not desirable, because when we try to pass the matrix band, it's not going to go through. So the simplest, if you're going to expand the box, if we're going to make it wider, then we only make the restoration harder to do later. So what I tend to use to separate, to create that separation, and either maxillofacially or even cervically, is I like to use a little burr that is the 8312-016, or you can call it a Mosquito burr. Basically, it's a very, very tiny, a pointy burr, diamond, and what is used for is when there's just a tiny bit of contact left, like you saw on the previous slide. I will use that burr, and I will just, with one quick careful pass, I will separate the tooth, and I will create the necessary separation so my matrix bands can go through. If you want to be a little extra careful, and you know, when you're using your Mosquito burr, you can always put a fender wedge from Garrison and protect your adjacent tooth. Sometimes I do, sometimes I don't. I mean, many times I can do it. I mean, I can do it, and you know, very, very carefully, and it will not harm the adjacent tooth. But if I feel the need, then I will put a fender wedge. So the preparation, you know, the preparation looks very, very different than a traditional GB black preparation, and basically the goal is to remove the caries, remove the mineralized enamel, and stay supra-gingival as much as you can, and you know, if need be to break the contact with the Mosquito burr, we will do that. Another important, you know, as you see right here in this particular example, this is really an onlay prep, but the reason why I'm showing this to you is because you can see there that again, the enamel preservation approach. I have a full thickness of distal enamel, but I still have caries on the dentin. Now, if I was going to remove the unsupported enamel, my preparation margin would clearly go 2 millimeters below the gum. And now we're getting into a complicated situation. If I have a full thickness of healthy enamel, then what I'm going to do is I'm going to carefully remove the caries on the dentin. And then after removing the caries on the dentin, I will repair the enamel, the weakened enamel, and then it makes my periphery of enamel, you know, more reliable. It keeps me supra-gingival. So those same principles can be applied to class 2s. Those same principles can be applied, as you see in this particular case, on class 3s, where the external outline is small, it's minimal. Internally, we have a much larger outline, but as long as we have a full thickness of enamel externally, we can preserve that enamel. We're going to repair it with bonded composite, and I will regain its, you know, close to its original strength. Now in this slide, you can see, you know, those class 3 preparations again, where the external outlines are smaller than the internal outlines, allowing me to really stay supra-gingival on all the preparations, keep the external outline smaller, doing the repair, the filling is going to be a lot simpler when I do it like this than if I do the traditional, you know, where the internal outline has to match the external outline. Then we would be way, you know, on every single one of these preparations, I would have been far below the gum and have to deal with bleeding, have to deal with difficulty achieving good contours, etc., etc. I do like to use, you know, this new Blue View strips, because it's easier to see them. It's easy to restore teeth when you have easy visibility, and all of those restorations we can do in very, very limited time. It really changes the game when we start staying supra-gingival and preserving the enamel. It is very important that we remove all the caries, and it's a very, very helpful adjunct is to use a cavity detector. I use them routinely after I check and confirm that there's no soft tissue, that my explorer, it feels that the dentin is firm, I still do a final check with my cavity detector, and often I find a tiny sliver of caries, especially in the enamel dentin junction. So use it, is very helpful. I like the Curare one. So right here we see the use of the caries detector. Don't leave it for very long, because if you leave the caries detector on a tooth for a long time, it's gonna stain everything anyway. So it should be applied and rinse quickly. After we have finished our preparation, now we go into our isolation. And I know some people really feel, especially when we're in dental school, we really, we get really drilled on the fact that if we don't use a rubber dam, we're doing substandard dentistry. And the truth of the matter is that research doesn't substantiate that statement. In fact, research shows that whether we use a rubber dam isolation or we use cotton roll isolation properly done, the results are consistently the same. But the one thing that we cannot forget is that if we have any type of contamination, whether we're using a rubber dam or we're using a cotton roll isolation, any contamination when we're doing adhesive dentistry means failure. So use whatever you prefer. If you want to use a rubber dam, go for it. And if you prefer to use any of the other tools that we have available in dentistry to isolate, whether it's just good, solid, good old-fashioned cotton roll isolation, or any of the other myriads of different tools that we have for isolation, it's absolutely your choice. Again, the thing is, perfect isolation is a must. After having a properly isolated field, then we're going to use our matrix band. Toffel-Meyer matrix bands are pretty much a thing of the past. I mean, almost don't see any need for them anymore. Really, whether it's a small cavity or a big cavity, there's nothing better than a segmental matrix in a ring. It gives us better contours, and it's very easy to use. To me, it's faster even than a Toffel-Meyer matrix band. So no, Toffel-Meyers are pretty much history. Now we are using rings, and one desirable thing to remember is that if your adjacent tooth is a little uneven, don't ever hesitate to pass your Softflex disc and flatten it a little bit, and get your adjacent tooth to have a decent shape before you place your ring. Once you place your matrix band in your ring, I would suggest that you use the Teflon coated matrix bands, especially with the newer bonds. All the newer bonds are bonding to metal and to all the universal bonds, Clearfield SC Bond and Clearfield SC Protect. All of these bonding systems, they tend to bond to everything. And if you put a traditional metal matrix band, good luck, because your composite and your bonding system is going to bond to your matrix band, and when you try to remove it, it's going to be difficult, and sometimes you get little pieces of your filling coming off as you're removing your matrix band. So I think a Teflon coated matrix band is really a smart idea. Those are also made by Garrison, so they're pretty useful. What ring system you use is really your choice. The newer ring systems have wider tines, and that allows us to use them in situations that are even where your proximal contacts are really wide. So I'm a little partial to the Garrison ring because of the softer tines. It seems to adapt the band a little bit nicer, but the Dentsply, Paladent brand, all of those seem to do. The Ultradent now, the V-ring now is being sold by Ultradent. Those are very good as well. So you can choose. It's your decision. But any of those work really good. Wedges, believe it or not, I'm still using mostly wooden wedges. I think they're pretty good, but the wooden wedge is still, to me, is one of my favorites. When you're doing your back-to-back composites, this is not like the old days when we used to be able to do uh, two amalgams at the same time. You're definitely gonna have to do one at a time. You're gonna have to do one composite at a time. So if you're doing back to back, by all means, do one, finish it, and then do the other, because otherwise you're not gonna be able to achieve really nice contacts. But you can do an MOD at the same time with two rings, or you can do a distal, a DO on one tooth and then an MO on the next tooth. If they're looking in opposite directions, then you can certainly put two rings at the same time and save a lot of time. So there's absolutely, you can do an MOD on the same tooth using rings. The next thing is liners and bonding systems, and certainly I'm pretty partial of using liners only when we have very deep preparations. If we have anything that is like 4 millimeters or more, definitely a liner is very desirable. I like to use liners like Ionosil from Boco, or Vitribond from 3M, or Fuji lining from GC. Those liners are very useful, and I like to put them only, again, on the very deep areas. And the liners have multiple purposes. One of them is certainly to protect the deep areas, and they just physically protect your deep dentin by covering it. But another purpose of liners is because they're more flexible than regular composite. They become a buffer zone. So when you have polymerization shrinkage, your composite will shrink, and as you see in this picture, the liner will in fact decrease the effect of the shrinkage. So the polymerization shrinkage. So on a research that I did with Sumita Mitra, we found that to be the case. That we found that the liners have a very positive effect on, especially on very deep preparation. So I encourage you to use a liner, and especially on the deep areas. Another use of resin modified glass ionomers is what we call the open sandwich technique. And I don't do this often, but it does have a value when you have a very deep proximal cavity, and you may, you want to repair it. Instead of doing like crown lengthening procedure, you may choose to use resin modified glass ionomer in those deep proximal boxes. The benefit of resin modified glass ionomer is that they are less sensitive to moisture, and it also releases fluoride. So some of the research that you see there on the slide show that in this type of cases, resin modified glass ionomer, the open sandwich technique is very successful. When it comes to bonding systems, I'm very partial to self-etch bonding systems. We do have some videos on our library that goes into a lot of details when it comes to adhesives and bonding systems. But let me just give you the gist of it. If I'm going to do a class 2 or class 3, I am going to always etch the enamel selectively. Usually I will etch it about 10 seconds. I will etch beyond the cable margin, because self-etch bonding systems by themselves don't etch the enamel very well. Wash, dry. It's better if it's a little dry than wet, but self-etch bonding systems are very forgiving to moisture situations. So if it's a little wet or it's a little dry, it's not a big deal. It will still work. Then after you etch, you wash, you dry, then you apply your primer. Your primer is a acidic resin that is going to dissolve the minerals in the smear layer and the dentin. It's going to create your resin tags. It's going to give you your smear layer. It needs time to do its job. So when you apply your primer, you need to let it settle there. You need to let it sit there for at least 25 seconds while you're where you're applying the primer. You apply it on the dent, and you apply it on the enamel. You go beyond the cable margin. You rub it for about 25 seconds. And the next step is crucial. Get rid of the solvent. It's very important. Manufacturers usually say, hey, blow air for 3 seconds. 3 seconds is never enough. You have to, the only way that you're going to be sure that you got rid of the solvent is visual confirmation. You're going to apply a medium stream of air, and you need to see that the liquid, that when it's wet, it moves. By the time you're done drying, you should not see the liquid move anymore. It should be still. And that at that point, that's the only time when you're sure that you got rid of the solvent. Right here you see the application of the edge, and of course that's going to be a quick application of the edge. We want to etch the enamel selectively, not the dentin. We're going to wait about 10 seconds, and then we're going to wash the edge. And of course, you want to be careful not to etch the dentin. You're only etching the enamel. Then wash dry. You apply the primer, and we already talked about it. You keep applying it. You keep rubbing it, especially on the dentin, but you're going to apply also on the enamel. And 20 seconds, make sure that you get rid of the solvent really well. And depending if you're using a 7th generation bonding system, in other words, all in one, after you blow the solvent, as you see me right here, you're gonna be done. You can cure with your light. If you're using a 6th generation, then after you get rid of the solvent, you are going to apply the bond. So very, very important that you get rid of the solvent. Now we're going to fill the cavity, and historically, when we started using composite, there was a lot of talk about the C factor, and some people recommended multiple increments of composite to minimize the effect of the polymerization shrinkage. In fact, today we have realized that lots of increments don't really make that much difference. We definitely don't want to do increments that are bigger than 2 millimeters. Currently, our understanding of shrinkage is we don't need to do so many increments, because ultimately it doesn't make that much difference, and that's what research is showing. So I tend to just do 2 to 3 increments depending on the size of the restoration. So this is a fairly large size restoration, as you can see on the picture. To me, this is a situation that requires 3 increments. The first increment is going to be a flowable that I'm going to apply on the cable margin of the proximal box, or the proximal area. Now this is a GB black preparation. This would have been a situation where I remove an old amalgam, and basically I'm left with a traditional GB black preparation. I'm going to, if you see the middle picture, the middle photograph, you will see me with a rounded instrument, burnishing the matrix band. I cannot understate how important it is to, every time after you place your matrix band, you have to burnish the matrix against the adjacent tooth. If you don't, sometimes you have good contact, sometimes you don't. If you burnish it every time, you're going to have contacts every time. Now, when I say burnish it, I don't mean like the old-fashioned gold burnishing that you spend there 5 minutes burnishing it. I'm talking about 2-3 passes. Push the matrix toward the adjacent tooth. That's all. You don't need to really do it for a long time. And then you do your increments, flowable first. I like to do horizontal increments. And if you have dark dentin, you may want to choose to use a second increment with a little opacious dentin to hide the darkness of the dentin underneath, so it doesn't look ugly at the end. If your dentin is of this normal shade, then this is a non-issue. I tend to wet my instrument with a little unfilled resin, because it doesn't matter what material is the instrument made out of, it still sticks a little bit. So now, when I wet my instrument with unfilled resin, I just barely wet. I don't want it dripping, because if it's dripping, then you're watering down your composite. If you use alcohol, that's a mistake, because alcohol is a solvent. It's going to start dissolving your composite. So alcohol is not a good choice. Unfilled resin is a good choice, but not very wet. So you create your second, you shape your second increment. You remember, the composite is not condensable. You're not going to use the little instrument to pack the composite. I don't like the term packable composite, because composite is not supposed to be packed. Composite is a little bit like butter. You're supposed to spread it. So you gently tease the composite in the direction that you want it to go. You don't pack it, you tease it, you spread it like butter. So you do that at second increment to just below the enamel, cure. You may choose to apply, stain. That's just something that makes me happy, but most of the times I try to avoid it, because some patients don't like the little stain, although we think it looks way more normal and more natural, but patients don't like it. And then the final increment is going to be, is going to be with a regular composite, and we're going to give it the morphology with our instrument before curing. It is way faster to develop the morphology when the composite is still unpolymerized than if you cure the composite and then have to do it with your drill. It takes a way longer when you have to develop the morphology with your handpiece. So develop morphology with an instrument. I like to use in fact, I developed this series, two instruments, composite instruments, that really make developing the morphology very quick. I like one of the instruments is basically like an acorn with a larger base, and with a few strokes of the instrument, you develop a pretty nice morphology, and all of this before you cure. Now you can see in this little video how I use a flat instrument. After applying that final increment, I use a little flat instrument to remove some of the excess, and then the final morphology is developed using the acorn. Now the acorn is used very similar to as the way we use an acorn when we were doing amalgams. The difference is composite, being the material that drags, we cannot run the acorn, from one end to the other of the restoration. We have to start in the center and then go to the end, following the grooves, allowing the anatomy of the remaining tooth to guide us. So we place the acorn, drag it to the side, wipe off the excess, place it in the center, do one stroke, and within a few seconds, as you can see, we can develop the morphology very well, including the marginal ridges, and it's very efficient. The next step will be, on the marginal ridges, I'd like to use an explorer to remove the flash, to remove the excess, so we have the least amount of flash as possible. After curing, you can see, and after removing the matrix badge, you can see that our restoration is almost finished. It looks pretty close to finish, but if you look at the picture all the way to the right, you will see that there's some flash, interproximal flash. Of course, that's normal. We always have a little flash, even with a properly adapted matrix mount. There will always be a tiny bit of flash cervically, proximally. How do we remove that flash? The number 12 blade. The number 12 blade is such a wonderful instrument. It allows us to remove that flash. The number 12 blade is very efficient. It only cuts composite. It doesn't cut tooth. It might hurt the gum a little bit, but the good news is the gum is going to heal. We definitely want to make sure we get rid of all the flash, especially cervically, because if we don't get rid of the cervical flash, we're going to have inflammation that is permanent. So the number 12 blade has to be used with 2 hands for maximum control. And we want to use it, we start planing the composite until we get rid of all the flash. Then the occlusal flash is removed with a with a 12-bladed bullet-shaped carbide, and I like to use it dry. The benefit of using that carbide dry is that when you're cutting the excess composite there in the flash, you can see when you're cutting composite, and when you get to the to the to the tooth, you can also see it very clearly, so you don't end up damaging the tooth. You can just remove the flash without getting into the tooth. So very, very efficient. The final step is the proper cure of the composite using an oxygen inhibitor. We all know that composite cannot cure in the presence of oxygen, so the very top surface of every composite is uncured, is the oxygen inhibited layer. If you want to cure all the way to the top, so you have better durability, better color stability, you want to use an oxygen inhibitor. And you can buy an oxygen inhibitor, which is basically a gel that inhibits the presence of the oxygen, and then on top of that you cure. Or you can use something like KY jelly, which is basically the same thing. It's a water-based jelly, and it covers the tooth completely so the oxygen cannot touch it. You cure on top of that, and you're gonna get perfect cure all the way to the top of the surface. The final step is always going to be to make sure that your proximal ridges are rounded. You never want to have your restoration with 90-degree angles on the proximal areas. You always want them rounded, just like nature. Nature is always rounded, and it's mechanically better. You have less chances of breaking, of chipping. And the final polish is using a Jiffy brush. A Jiffy brush is a diamond impregnated a polishing brush that is used with a lowest speed handpiece, dry at maximum speed. You can see me there using the Carbide Bur, and we do it, only a few passes. I only need to get rid of the flash. And then after the Carbide Bur, we, of course, in adjusting the bite, always making sure that you use that two-color technique for bite adjustment. And our library at the LA Institute has a few videos that explain the details of that bite adjustment. That is so important. I have to emphasize. You want to adjust the bite really, really well with a two-color technique. And then the very last thing is to polish it. When you polish it, you're gonna get nice finishes. If you use this simplified technique, you're gonna find yourself doing very quick and efficient class 2s. They look very, very pretty. They have the right morphology, that you do it on a timely fashion, and that also they become efficient and profitable at the end. If we're efficient, if we can do a great job and not have to worry about sensitivity, then you can do them with a lot of confidence and become much more effective. So you can see a picture right there of the number 12 blade being used. Again, we are planing, getting rid of the flash, especially interproximally, very, very efficiently with the number 12 blade. And finally, I want to thank you for your attention in this video. I hope it's been of value. You're welcome to visit our website and our forum, a community forum. You can place any questions, any comments that might be helpful for you. And otherwise, we also have wonderful, very practical hands-on workshops. So visit our website, and I hope you have a wonderful day.